I'm Ella. I'm a registered Nurse Associate working at Staplehurst Health Centre. So I started here as a phlebotomist and they trained me up to be a HCA, and which included my CAS pack, which was equivalent of an MVQ, which I used to get into university. I was really lucky that everything aligned perfectly to get that after I realised that I was able to do that apprenticeship. I was poorly a few years ago in hospital, and one of the people that looked after me was a nurse associate in the original format, and she was lovely and she told me all about her course and why she did it, and she was just the nicest person there, and I thought after that I'd like to do that as well. My employer was really easygoing about it. They allowed me to go off 1 day a week. It was really handy because I learned things that the nurses here don't practice doing anymore, because obviously their area of work has changed. So it was really good. I got to learn things like catheter care, IVs and things like that. It was really interesting. I just got so many more skills that I wouldn't have learnt here. I found the academic side of it much harder than the skills, because I'm a much more hands-on learner. But the university were quite supportive, and I'm quite severely dyslexic, so luckily my friends were really supportive as well. So the medical secretary would read through my essays and make sure they made sense before I submitted them, because I'm not very good at spelling and things like that. But once I got a hang of Harvard referencing, which I got help from the library to do, it was so much better. The worst bit was waiting for the results of the essays that you've written, because you spend a few weeks wondering if you did it or not, but you do get the hang of it after a few tries. I loved my placement at the hospice. It just gave me a whole new perspective on caring for patients. So like in the GP surgery, you're caring for patients, trying to make them well, whereas in the hospice it's a completely different dynamic. You're looking after patients to make them comfortable and give them dignity. You're not trying to make them well. And the nurses were just lovely, and I got to learn about drug administration. It was my favourite placement out of all of them. Yes, I struggled with the academic side. I found it very hard to begin with, and sort of halfway through the course I was exhausted. It was midway through COVID. I was so tired, but I'm so glad I stuck with it, and I keep saying to other nurse associates in training that I meet, I'm like, halfway through you're gonna wish you never started this, but keep going, it's worth it in the end. My boss, she was really sweet at the time. When I got in, she presented me with a big bag of stationery because she said, oh, you're someone organised and we got you this to help. And they set me up a little state training station upstairs so that I could be upstairs uninterrupted while I was writing essays and things. They were very flexible. They gave me time to do essays in clinic, like when I should have been in clinics. They were really lovely about it, and they just basically gave me as much time as I needed with the nurses. So I sort of did a day and a half a week just with shadowing the nurses, and then I went from shadowing to doing with them, and it was really, really beneficial to get that support. Stick with it. Like I said, halfway through it seems like the worst mistake you've ever made, but it's so worth it. Don't get walked all over as a student. They want to use you as a HCA, but you need to say that you're there to learn and not to be used to just wash patients and things like that. Be clear with the nurses on your placement. What do you need to learn? Like, for example, there was a stage where, because I work in a GP surgery, I don't wash patients. So when I did my ward placement and my hospice placement, I said to them, I need to learn how to wash patients and make beds, and they let me do that. And then next week I was very clear, and I said I'd like to do a drug round, and I got to watch that. I got to help, but you got to be clear of what you want to learn, else they'll just use you in the numbers. So I'm currently in the middle of my 9-month smear course, which I'm really enjoying, and it feels like a really good important thing to learn, because obviously you're helping prevent cervical cancer. In the future I want to build on my wound care skills because I really enjoy that. And there's lots of courses that you have access to, especially in primary care, because you can use Victor. They advertise really good courses. But also, I just contacted Hazel and said what courses are available, and she sent me a 5-day course and things like that I've booked. So really, you can build on the things you want to learn more about, which is really good. In the future, I will do my top up to become RN. But right now I'm happy just sort of learning the bits that I'm really interested in, because then my appointment screen can be built around those things that I'm interested in. So like now the receptionists know that I love wound care. So if we get an emergency wound care, they know I'm up for it. I like that sort of thing.